in our response to the COVID-19 pandemic. Today, Wednesday the 10th, March 2021, is exactly 351 days from the day the first case was imported and detected in Uganda. As you are aware, the pandemic has caused a heavy death toll, disrupted livelihoods, and rolled back progress in human development like no other public health emergency over the past 100 years in a relatively short period of time. Globally to date, there are over 117 million cases and 2.6 million deaths from COVID-19, and that has shrunk global economic activity. In Uganda alone, over 40,000 COVID-19 cases have been reported and 334 deaths have been registered so far in the health facility, with the country's gross domestic product shrinking from 6.8% in financial year 2019 to 2.9% in financial year 2020. In the absence of very effective treatment options and low adherence to the known public health and social measures, COVID-19 vaccination is the game changer in the response to this pandemic. We now know that COVID-19 vaccines provide the most potent means to save lives, prevent severe forms of the disease, thus protecting the health systems from congestion, reinvigorate livelihoods, and enable the full reopening of the economy. Uganda now joins the rest of the world in the race to vaccinate at least 49.6% of its population. That's about 21.9 million people, including the refugees, with the COVID-19 vaccines in a phased manner. Each phase is planned to cover 20% of the target population, which is about 4.4 million people. The eligible population lies in the age range of 18 years and above. In the context of global pressure on vaccine stocks, the priority persons to be vaccinated is guided by the occupational risk of infection, the risk of developing severe disease, death from COVID-19, and population characteristics, including age, gender, and geographical location. Private not-for-profit and private for-profit facilities. These are estimated at 150,000, including the support staff. That is what health workers mean. It will also focus on security personnel, the UPDF, police, and prisons, estimated at 250,000, and these have been at the front line, as you all are aware. We'll also focus on teachers, both in public and private facilities, among other essential service providers, and they are estimated at 550,000. Persons from the age of 50 years and above, who are estimated at about 3.3 million persons. Persons with underlying health conditions aged below 50 years or from 18 to 50 years, estimated at 500,000. And other emerging high-risk population priority groups, including the airline workers, the media, prisoners, tour operators and guides, bankers, immigration officers, the Wildlife Authority, Revenue Authority, humanitarian workers, and others who will be identified by the Vaccine Advisory Committee.
World Health Organization representative has elaborated the COVAX facility and how it has started. Without the donation and the support of individual countries in the midst of the COVID, when even all the individual countries were facing the pandemic challenge, but the countries donated and created this COVAX. And want to thank you so much. We want to thank in a special way UNICEF and World Health Organization. These two agencies they are not like UN. They are they are part of Ministry of Health, because whether night, whether Sunday night, they are in meetings with us. So we really want to thank you so much for the dedication and commitment that you have really shown to service. To our staff, Ministry of Health, words cannot express what you have been to us. To our clinicians, to our medical workers, ranging from consultants to junior doctors, to nurses, to laboratory, to radiologists, to all the team, including cleaners in these hospitals where COVID patients were being treated. We owe you so much. We cannot say thank you. Thank you is not enough. But we want to tell you that your contribution is so valuable. We value you, we appreciate you, and want to say that you are the reason we are here. And want to say we are proud of you, and we can assure you that we shall go and we shall win this battle. Where we are to witness this vaccine, we did not know. In March last year, we had no idea that would be here launching this vaccine. But we are here because you have saved lives. I want to thank Mulago Hospital and Entebbe and the regional referral hospitals where our patients have been, that they bore the whole pressure of the country at the time we were really, really going through hard time. We want to thank you so much for bearing that weight.
First of all, because if we go back to last year, March, we can see that Uganda has an outstanding track record in fighting corona disease. And we remember the first months, the measures kicked in, the decisions were taken by the government on restrictions for all of us. We had to stay home for a while, no private transportation. So some people were questioning, is this the right way? Well, I think that history has shown that this was the right way. That this is a country that has listened to the scientifics, to the doctors, medical doctors, and how do you call these? The people specialized in pandemics. So this country has listened. You know that the president several times has mentioned that in this crisis we need to take the advice of the scientists in several of the speeches. And that is what this country has done. And the results are there. I remember that back in June or July, we, as diplomats here in this country, we developed some social media campaigning material to show the impact, the positive impact of the measures on the numbers. I shared that with the minister back then. And so we were convinced from the beginning that this is the right approach, and we still see that today. So we are happy to be here in a country that has listened to the scientists, that has really taken up this challenge and put forward excellent results, not only in the world, but even in the region here. If you compare with many other countries in the region, I think that Uganda really stands out.
Adequate vaccines for all these people at once, but as the vaccines come in, we shall continue to prioritize them. In phases 2 and 3 of the COVID-19 vaccination program, the ministry will roll out the vaccination program to age groups between 18 and 50 years of age in a staggered manner until 49.6% of the Ugandan population is vaccinated. This exercise will also be guided by the local epidemiology of the disease. Right now, our chief guest, Ugandans are assuming that COVID is no longer with us. But the people in the isolation unit in Mulago can testify that we are still getting cases, and some are severe and they are succumbing. And so I want to remind Ugandans that while we reached our peak and plateaued and dipped, there is a likelihood that we can go into the second wave of the pandemic. And therefore, it is important to remain on alert and take care of your health. COVID-19 vaccination today, the first group to receive the vaccine are our dear health workers. All health workers from public, private not-for-profit, and private health facilities will be the first group to receive the vaccines. This is because they are at the front line, as you have heard from the various speakers, in response to the COVID-19 pandemic and are vulnerable to infection, as has been shown by the statistics of infection. We have over 1,900 health workers who have been infected by COVID-19, 19 of them succumbing to death. It is at this point that I will humbly request all of you to stand up for a moment of silence as we remember those who succumbed to death.
Batch number.